Behavioral health nursing is a crucial area of healthcare. It focuses on the mental well-being of individuals, families, and communities. This specialized field of nursing recognizes the profound impact that mental health has on overall health outcomes. Nurses in this field are dedicated to providing compassionate and effective care to those facing mental health challenges. At the heart of behavioral health nursing lies the nursing process, a systematic framework that guides every aspect of patient care. This process consists of 4 key stages: assessment, planning, intervention, and evaluation. Assessment involves gathering information about the patient's mental state, history, and current needs. Planning follows assessment, with the care team developing a tailored care plan. This plan outlines specific goals, strategies, and interventions designed to address the patient's unique circumstances. Interventions represent the actions taken by the healthcare team to implement the care plan. Finally, evaluation involves a thorough review of the patient's progress. This step ensures that the care plan remains effective and is adjusted as needed to optimize patient outcomes. This systematic approach ensures that care is individualized, holistic, and focused on promoting recovery and well-being. Behavioral health nurses are trained to provide a wide range of interventions, from administering medication to providing individual and group therapy. They work in various settings, including hospitals, outpatient clinics, and community mental health centers. Their work is essential in helping people with mental illness manage their symptoms, improve their quality of life, and achieve their full potential. Behavioral health care encompasses a spectrum of services to address diverse needs. These services are often categorized into 3 levels: primary, secondary, and tertiary care. Each level plays a vital role in providing comprehensive and accessible mental health support. Primary care serves as the first line of defense in mental health. It focuses on preventing mental health issues from developing in the first place. This level of care often involves raising awareness about mental health within communities and schools. Educational programs on stress management, coping mechanisms, and healthy lifestyle choices are common components of primary care. Secondary care comes into play when early signs of mental health problems emerge. It emphasizes early detection and intervention to prevent these issues from escalating into more severe conditions. Screenings for depression, anxiety, and substance use disorders are typical in secondary care. Tertiary care, on the other hand, centers on providing specialized and intensive care for individuals with severe and persistent mental illnesses. This level of care often involves inpatient hospitalization, residential treatment programs, and long-term case management. The goal is to help individuals manage their symptoms, improve their functioning, and enhance their overall quality of life. Tertiary care plays a crucial role in supporting those facing significant challenges related to their mental health. In the realm of behavioral health nursing, therapeutic communication stands as a cornerstone of effective care. It involves a unique set of communication skills that enable nurses to establish rapport with patients, understand their experiences, and foster a sense of trust and safety. Unlike casual conversations, therapeutic communication is purposeful and focused on the patient's well-being. Active listening is a fundamental aspect of therapeutic communication. It involves not merely hearing the patient's words, but truly listening to their underlying emotions and concerns. Nurses who are active listeners pay close attention to both verbal and nonverbal cues, such as body language, tone of voice, and facial expressions. Empathy, the ability to understand and share in another person's feelings, is another crucial element. Empathetic responses convey to patients that their emotions are valid and understood. Instead of offering unsolicited advice or minimizing their experiences, nurses utilize empathetic statements to acknowledge and validate their feelings. Open-ended questions are powerful tools in therapeutic communication. Unlike closed-ended questions that elicit simple yes or no answers, open-ended questions encourage patients to express themselves more fully. These questions often begin with words like how or what and invite patients to share their thoughts, feelings, and perspectives. By creating a safe and supportive environment for open communication, nurses can gain valuable insights into their patients' needs and concerns. Section 4, Psychopharmacology, Medications and Mental Health. Psychopharmacology, the study of how medications affect mental processes and behavior, plays a vital role in managing mental health symptoms. Psychiatric medications are often prescribed to help individuals experiencing conditions such as depression, anxiety, bipolar disorder, and schizophrenia. These medications work by targeting specific neurotransmitters in the brain, chemicals that influence mood, thoughts, and behaviors. It's essential to understand that psychiatric medications are not a one-size-fits-all solution. The choice of medication, dosage, and treatment duration varies depending on the individual's diagnosis, medical history, and individual responses. A collaborative approach between the patient, psychiatrist, and nurse is crucial in determining the most appropriate medication regimen. Patient education is paramount in psychopharmacology. Nurses play a vital role in educating patients about their medications, including potential benefits, side effects, and the importance of adherence to the prescribed regimen. Open communication about any concerns or side effects is encouraged, as adjustments to medication or dosage may be necessary. Monitoring for side effects is a crucial aspect of psychopharmacological treatment. Some medications may cause mild side effects that subside over time, while others may lead to more serious adverse reactions. Nurses are trained to recognize and address potential side effects promptly, ensuring patient safety and well-being throughout treatment. Regular follow-up appointments with the prescribing physician are also essential for ongoing monitoring and adjustments to medication regimens as needed. Section 5. Client-centered care. Respecting individual needs. Client-centered care lies at the heart of behavioral health nursing. This approach recognizes that each individual is unique, with their own values, preferences, and cultural beliefs that should guide their treatment. In client-centered care, the patient actively participates in decision-making, ensuring that their voice is heard and their needs are met. Respect for the individual's autonomy is paramount in this approach. Patients have the right to make informed decisions about their treatment, even if those decisions differ from the recommendations of healthcare professionals. Nurses who practice client-centered care create a safe space for patients to express their preferences and participate in shared decision-making. Cultural sensitivity is an integral aspect of client-centered care. Mental health is understood and experienced differently across cultures. What is considered normal behavior in one culture may be viewed as atypical in another. To provide truly client-centered care, nurses must be aware of their own cultural biases and strive to understand the cultural perspectives of their patients. They should approach each interaction with openness and respect, seeking to understand how the patient's cultural background shapes their beliefs about mental health